Since I cover, you can go back just a little bit. Since I cover how to start a home care agency and how to start a nursing agency on this channel, I get tons of inquiries and consultation requests from people looking to enter these businesses. I've been providing one-on-one mentoring and also helping people start in healthcare staffing, offering everything from basic training to turnkey companies that are fully set up. By fully set up, I mean everything from your logo design to your policy and procedures, and even sourcing capital for payroll, which is kind of intimidating for most. This way, budding entrepreneurs can plug and play right away in their own healthcare staffing company. In today's video, I'm going to talk candidly about home healthcare versus healthcare staffing and try to help you find which of these companies is best for you. You'll also see I'm pretty biased and get an idea as to which of these companies I prefer. On this channel, I discuss living globally along with business hacks in real estate and healthcare, showing you the path so you can do the same. I want you to be able to go out there and live your dreams. If this content is the type of content you want more of, like, subscribe, and turn your notification bell on so you don't miss a thing. My name is Carl Pierre, and this is ENTP Life. First up is non-skilled home care. The American population is aging, and along with that comes the need for assistance with activities of daily living. And that's where non-skilled home health care companies come in. You see, people are getting to a point in their lives, especially the majority of the American population, is getting to their golden years where they can't do as much on their own. They need assistance with bathing, getting dressed, making sure that their home is in a full hazard, medication reminders, all of the things that are gonna help keep them in the best condition for a comfortable, long life. Personal care agencies, or these non-skilled home care agencies, really are governing their chronic diseases and creating a care plan that fits them to live a comfortable life. You're not dealing with anything that is complex. It's mostly companion care and almost a role that a family member would play in caring for one of the elders in their family. Now, a lot of people get started in non-skilled home health care because it has less moving parts. It's looser regulated than skilled home health care, and it tends to be a place where people are more comfortable getting started because they see it as less intimidating. Also, there is this idea that there are more caregivers available because the skill level is a little bit lower, so there's more people to recruit, and it ultimately appears as if it's an easier business. The problem with non-skilled home health care is that you have really two payers. One is going to be a state-sponsored program, usually sponsored through Medicaid, and the other is going to be private long-term care insurance or self-pay. So finding these particular types of patients that have a payer source that is private or qualify for Medicaid can be a little bit challenging and make it a bit difficult to start their business. So when you're dealing with a personal care agency or a non-skilled home health care agency, you have a few things that you have to do. Okay. So when you're starting with a personal care or non-skilled home health care company, there's a couple of things that you have to consider. First thing is that you need to get licensed in your state, and that could be a pretty difficult process. You got to go through policy and procedures, get approved by the state, and get this official license to operate. Then you got to go about finding your own patients and caregivers, and then managing that entire process so that you're meeting the regulatory requirements, the expectations of your employees, and sourcing and finding and retaining your patients. So it's a lot of moving parts, even though it seems like the simpler of the two home care agencies. Now that we've talked about personal care, the next logical company to talk through is skilled home health care, or what some people refer to as Medicare agencies. The medical model for skilled home health care varies in that it's meant to be for high-skilled, high-need patients. These are patients who are coming out of the hospital with acute conditions. They may have a chronic wound that needs to be addressed. They may have just had their first heart attack and need education on how to manage their new heart disease. So it's not this long-term care where you're dealing with people who are aging and just need assistance with activities of daily living. You're almost functioning as an extender of the hospital, or even if you want to think about it another way, you're functioning as a community-based nursing home, where you're taking care of people's real conditions. This may be at-home IV therapy, it could be wound care, it could be physical therapy after someone has had a total knee replacement and they need to get back on their feet, literally, and get the exercise and strengthening that they need so that they can re-enter society. This isn't reserved for people who just need assistance. This is really meant to be for a 30 to 60 day period where you're helping somebody get reacclimated and back into their normal condition. Now, the thing that attracts people about skilled home healthcare is that it tends to be a little sexier in that it is a harder license to get. It also reimburses a bit higher than personal care does. The downside is that you're constantly having to admit and discharge patients. Home care or personal care, you typically have those clients for their life. For as long as they're satisfied with working with you, they're going to stay with your agency. The skilled patients typically don't have a chronic long-term need. So once you solve their problem, it's on to the next patient and sourcing a new patient. So that marketing effort is nonstop and constant. You gotta nourish your referral chain. You have to develop these relationships with physicians, with facilities to ensure that they keep your pipeline of new patients nice and full. On the other hand, you could grow a census of personal care patients of 500 clients, pull back on your marketing efforts and just maintain those clients for as long as you want and not really have to worry so much about sourcing new clients. You're going to lose clients because they relocate, pass away, or lose their funding, but it's not as rapid of a turnover as you're going to experience with a skilled home care agency. Skilled home healthcare really is for people who are skilled professionals. I think the best founders are going to be your therapist, your physical therapist, your nurses, your speech therapists, who are concentrating on a particular tranche and they absolutely love providing that sort of service. They also are going to want to feel comfortable working inside the community setting where they are going into different homes, different cities, different neighborhoods, getting to know different people. You have to like that hustle and bustle, or else you're going to have a hard time dealing with skilled home healthcare. In skilled home healthcare, one of the main payers is Medicare and the Medicare Advantage plans. But then you have all of the private plans, and you're going to be able to take care of patients from pediatrics all the way to geriatrics and everything in between, because the payer sources are a little more diverse. You could take Medicaid clients, you could take Medicare clients, you could take private insurance, the Advantage plans, cash. It doesn't quite matter. There is no limit to who you can service. So if you want a broader customer base, skilled home healthcare may be for you. Last on this list is where I got started and where I advise most people looking to launch a healthcare business to start as well. That is healthcare staffing, or what most people think of as nursing agencies. My start into the healthcare entrepreneurship world was through healthcare staffing or running a nursing agency. Me and my mom started it together, and we were working on this nursing agency, kind of filling any short-term or long-term gaps that skilled nursing facilities have. The cool thing about healthcare staffing is that it's loosely regulated. So in most states, you don't have to worry about getting licensed. And in the states that you do have to get licensed, you usually are allowed to provide some level of home care services. So it's a perfect launching point for anybody who's looking to get into this line of business without having to be a skilled professional or without having to be licensed within that state. So the barrier to entry is fairly low. Also, as you know, especially during the pandemic time, there are shortages and major stresses to the healthcare system. So if you're able to help facilities meet their staffing shortages, there's money for you to make there. Another thing about healthcare staffing that I find really interesting is that you're not limited to one single geography. When you look at home care and home healthcare, both skilled and non-skilled, you're dealing with licensure that limits you to your state, even down to a county level, where if you want to work in a broader geography, you have to apply for additional licenses or additional permission to work in those zones. With healthcare staffing, you can create your company in one state, but service in 15 different states. So it's far broader, you have great potential to scale, and these professionals are always in need. And now you don't only have to concentrate on nurses. You could staff physical therapists, speech therapists, respiratory therapists, x-ray techs, CAT scan techs, surgical technicians, medical assistants, nurse aides, pretty much anybody who's working in the healthcare environment, you could technically staff through this agency. Meanwhile, if you're doing one of the other license paths, you're going to be restricted to whatever your license says. So again, healthcare staffing, much broader to get into. You have multiple geographies that you can work out of, and it's easier to get started. Now, the cool thing about healthcare staffing is that if you have ambitions of opening up a home care agency, the portion of recruiting, onboarding, managing a workforce is exactly the same. The standard that you have to hold these employees to are going to be the same because you're going to be staffing them in licensed facilities. So putting together their applications, reviewing their medical records, reviewing their personal records to ensure that they have all the documentation required and expected of healthcare workers in the USA, you're going to need to do the same exact thing. So it's almost like a basic training or basic setup in the human resource side of the home care businesses. Because again, when you're dealing with staffing, you're only dealing with that human resource end. When you get into home care and skilled home care, you're also responsible for coordinating and organizing the care of a patient and sourcing those patients. So if you are just thinking about getting into this business, I think it sets a perfect platform, the perfect launching point to decide whether or not this is for you without having to spend hundreds of thousands of dollars to get started. If you plan on getting into any of these recession-proof businesses and need help, feel free to reach out to me at info@entplife.com. Right now, we're working one-on-one with highly motivated founders, getting them started on their entrepreneurial journey. A select few are putting their businesses in our hands so that we can cut their time and have them up and running their own agency in as little as 8 to 12 weeks. You get direct coaching and full service setup. I would love to help put you on the right path. Like, subscribe, and share this video with anyone that you know might benefit from it. Until the next time, take care.